The premiers of Ontario and Quebec want the feds to increase what's known as the Canada Health Transfer, arguing the pandemic has put enormous strain on their healthcare systems. So will the feds respond with more cash? Patty Hajdu is the federal minister of health. She joins us from Toronto. Hi, Minister Hajdu. Welcome back to the program. Thanks for making time for us.
Thanks, Vashti. Nice to be here.
You heard me lay out there in the introduction what the premiers of Ontario and Quebec very specifically and in concert made a plea for yesterday in their press conference. Is your government prepared to increase the health transfer to provinces in light of the pandemic?
Well, I think, Vashti, we should start with the $19 billion that we've committed for a safe restart. About $11 billion of that is actually healthcare money that goes towards strengthening contact tracing, strengthening testing, strengthening their capacity to gather data. This is not an insignificant amount of money. We've also committed, as part of that $11 billion, the offset of the cost for personal protective equipment for their frontline staff and workers. Obviously, always open to conversations about what they need, but I'm really looking forward to how they'll spend that $19 billion, as I said, about $11 billion to get testing up to the capacity level that we know we need going into the next several months.
So the way that your government actually framed that $19 billion was very specific to a safe restart, and it's supposed to span about 6 months. So your government has on its own said that that money is not for permanent health care, it's to get you through this stage and the ensuing stage of the pandemic. What the premiers are talking about is more long-term damage, if you will, to the healthcare system, or more long-term needs that they will have in light of the pandemic. And hence my question is not about that money, that $19 billion, which yes is substantial, but is for a safe restart, but a more permanent solution in the form of increases to the health transfer. And the question is whether or not your government is actively considering doing that.
Look, Vashti, we want to have a world-class public health system across Canada, and I'm happy to have those conversations, like I said, with both premiers. In fact, all of the ministers of health across the country in an appropriate forum. But what I remain focused on right now is the next 6 to 8 months. We've got a long way to go to reach our testing capacity that we've committed to Canadians of 200,000 tests a day across this country, and I need, obviously, provinces and territories to spend that money quickly and efficiently to get to that capacity. They need to be supporting their local public health units with the capacity to do all that contact tracing. And of course, we have a huge data problem, which we've had for a long time in this country around health systems and health data. And that needs to get sorted out as well. So I think we can't put the cart before the horse, so to speak. And I'm really excited to see what they'll do with this initial tranche of money, as you point out, for the next 6 to 8 months, but also to prepare the systems for the eventuality of increased cases and other emerging diseases. I think this is the kind of work that needs to be done right now.
Are there issues with spending that money? You kind of were hinting there that you want them to do it quickly and you want to see how they're going to do it. Is it not being spent?
I would like to see that we get to that target of 200,000 tests a day. And what I'm saying is there's a lot of work to do to get there. And provinces, I know, are working day and night to try and improve their testing capacity and turnaround to ensure they have the contact tracing systems and data and people in place. And of course, to make sure that their healthcare systems are ready with plans if they do see outbreaks in any parts of their jurisdictions. I think we have to stay focused on that. And I think there will be plenty of time to talk about the rejuvenation of the healthcare system in general once we get through this next very critical 6 to 8 months.
Are you worried about specific provinces, though, or do you have evidence that they're not going to be able to do what you just laid out?
Well, what I'm saying is it's an enormous amount of work. And if you think about the fact that as cases rise and we still have provinces and territories that are putting into place stronger systems around testing, again, contact tracing, improving their data systems, that's a lot of work to focus on. And what I'm saying is there's always a potential to have conversations about how we improve the public healthcare system in general. I think this government has been very open that there are gaps, such as pharmacare, for example, that need to be addressed. But I really want focus now on the next 6 to 8 months to be about protecting Canadians from this very pressing health threat that we all face.
I mean, your government is open to pharmacare, but But prior to the pandemic, there was really no money allotted to implement pharmacare. It was just to consult with provinces. So I think that some provinces, and specifically Ontario and Quebec, I take your point about the next 6 to 8 months. For them and what they have described, it's not just about the next 6 to 8 months. Am I to interpret what you've just said as you're not going to have that conversation until the next 6 to 8 months passes?
I think what I'm saying is first things first. And I think Canadians know that we have a public health emergency on our hands, that COVID-19 is presenting an unprecedented challenge for Canadians all across this country, and that we need to stay focused on what we need to do right now. Of course, as I've said, we're always happy to talk about how we improve the public health care system together, but let's stay focused on the priority, which is right now making sure we have capacity to deal with whatever COVID-19 throws at us in the months to come.
Okay, I do have a question about something that is happening right now, and that was also raised by Premier Ford yesterday around quarantining. He says that about 622 cases have been discovered in Ontario where people are supposed to be quarantining, so they've submitted a plan, and people go and police go to check up on them, and they're not there. And yet there have been only 2 charges out of that. He says that the system is broken, and he wants the federal government to do something about it. Is the federal government looking at any changes? And do you think that ratio, that 2 out of 6, more than 600, is a concerning one?
I can't speak to those specifics because I don't have, I don't know what the cases look like and why the police didn't follow up with charges. But I can tell you that the OPP, who in this case are the ones investigating, have the full authority under the Quarantine Act to penalize people if they're breaking quarantine and if they find that people are not adhering to their quarantine requirements. And so I just refer Premier Ford to advise the Ontario Provincial Police and local municipal police that they have the full authority to do this on behalf of the Government of Canada if they find that people are not adhering to quarantine.
Is it the Quarantine Act itself, though, that needs to be revisited? From your perspective, do you think there is enough, leverage there for police forces to be able to, if they deem it necessary? I just think for people watching, when they hear 622 people and only 2 were charged, there seems to be a disconnect. Is there a role for the federal government? Is there a role to revisit the Quarantine Act itself?
I don't think so, Vashi. I think what there is a role to do is to make sure people understand that they do have the capacity to levy fairly significant fines and use the full authority of the current legislation that's in place. And they have been empowered to do that. And so we just have to make sure that everybody who is doing those checks understands that they do have that authority. I'm not sure why only 2 out of 622 received fines or penalties of any kind. Who knows? It's hard to know that without understanding the rationale from the people that are doing those investigations. But I'll just remind Premier Ford and in fact all of the law enforcement officials across the country who are doing those quarantine checks that they do have the capacity to enforce those penalties should they feel that they are warranted to do so.
Okay, I also want to talk to you. I think about what I'm sure you're thinking a lot about, and so many Canadians are, and that's when we watch these provincial updates and we see in a number of places across the country there are upticks in cases and some concern about, the trajectory of the virus. We hear it talked about a lot south of the border. And lately, the big headline is around this piece of journalism from Bob Woodward, who is saying that, according to him, President Trump told him back on February 7th, this is deadly stuff about the virus, more deadly than even your strenuous flus. He was told, according to Woodward, in a top secret briefing on January 28th that COVID-19 would be the greatest threat of his presidency. What I'm wondering from a Canadian perspective is, were you as Minister of Health or other members of cabinet briefed to the same effect on that timeline? Did you know in late January and early February that COVID-19 was as deadly as President Trump was being told?
Well, absolutely, we knew it had the potential to kill a lot more people than the flu. We knew that there were lots of things that we didn't know about COVID-19, and of course, we've learned more and more as science has researched and understood the virus more and more. But we never for 1 minute underestimated the potential of this virus to wreak havoc, not just on the health of Canadians, but certainly on the functioning of the Canadian society. And so we've taken it very seriously, and in fact, all levels of government have, and I think that's been a real hallmark of of the Canadian response, and has been noted, in fact, by journalists around the world that Canadians, despite the fact that we have a variety of different stripes of politicians across the country and different perspectives, we have all taken this virus deadly seriously. We started meeting at an officials level and at a political level early January to make sure that we could be as prepared as possible and to put into place measures that would protect Canadians. And I think, that's the approach that we've had from the very beginning.
Do you understand, I guess, how some Canadians might have questions? And I think I would agree that a lot of people certainly, once the government sort of put into effect the travel restrictions, everyone kind of, politically at least got on the same page and there was a lot of action taken. But we're talking about a timeline that's early February, late January. At the beginning of March, you were still saying that the risk was very low. And I know that we've spoken about this before, but I think it becomes difficult when we start hearing, okay, well, the information that people had on their hands, that the cabinet had on their hands, or that you knew about, was that this is more deadly than the flu. Why wasn't anyone sounding an alarm for Canadians? Why did it take so long to do what you ended up doing, which I'm not disagreeing was the right thing, but could it have been done earlier?
We were doing things very early, Vashti, and I think the implication that we weren't is actually incorrect. I mean, the measures were proportionate to the risk at the time. For example, when we had 0 cases or 1 case, in fact, we were screening intensively from regions that were most affected. We were supporting efforts internationally to try and suppress that virus at its source, which is public health best practice. I mean, what we really want to do is try and contain it at its source. And when it became apparent that this growth was exponential in countries that weren't even reporting a case, we took stronger measures. So all along the way, we've been taking appropriate measures based on the risk it was presenting to Canada. Of course, we knew that the virus was deadly. The real question was how significant was it going to be in Canada, and whether or not the measures that we were taking were the right ones. And so all along the way, we've worked with provinces, territories, local government, as I said, to ensure that we have a response that's fulsome and that's collaborative. And that, I think, has made a real difference in our country.
Respectfully, I mean, this reporting is talking about late January, early February. Travel restrictions didn't come into place in this country until the middle of March.
No, but screening did, Vashti, and extensive screening at the airports, and making sure that we were working with local public health, tracking every case, doing the contact tracing, investing in making sure that provinces and territories had the capacity to do that. That's the work that had to happen at that time. The foundation had to be laid to make sure that if we saw a growth in cases, that we would have that foundation in place. And in fact, that's been part of how we've managed to get through so far. Now, in terms of border measures, of course, had we proposed in January, where we had 0 cases, that we were shutting all international borders, I think that would have been seen as rather extreme. And instead, what we did was exactly what's recommended in a case like this, in a situation like this, which is ample screening for people from the affected areas. And as I said, as soon as we realized that this was a global pandemic, way before the World Health Organization called it one, there we were taking stronger measures yet again. And so it's very, very important that measures are commensurate with the actual risk at the time. And I think, I just have to commend my colleagues across all levels of government for the seriousness that they took this pandemic with, and for their clear and concise and honest communications with Canadians, telling Canadians about the risk, about what they can do to reduce the risk, about the measures they need to take to protect themselves and their families. That's the important piece, I think, that is a part of the Canadian story.
Speaking of honest communication, President Trump is saying and promising that there'll be a vaccine south of the border by the end of the year. What is your most, clear communication to Canadians on a timeline for one in this country?
Well, I've always said that vaccine development is extremely difficult, and that immunology is a really difficult field, and that, of course, we are part of a global effort to find a vaccine. And that we are investing in a number of promising vaccine candidates guided by the Vaccine Task Force. But I will say this, it is a difficult piece of work to create a vaccine for a virus like coronavirus in such a rapid time. Typical from sort of beginning to end in regulatory authority of the development of a vaccine, a timeline is about 4 years. We're trying to accelerate that in a year and a half. I think my message to Canadians is that we're going to have to continue to take the measures we're taking to protect one another and to protect ourselves. We're going to have to ensure as a country that we're investing in all kinds of research around therapeutics. And hopefully all of that research will pay off, and we'll have a blend of resources that will help ensure that we can eliminate COVID-19.
Is it unreasonable, I guess, for Canadians to expect any kind of more, and I'm not saying, tell us the day that the vaccine will be made available, but when they're, I can imagine, but when they're watching, you know what I mean, you're consuming news south of the border and you hear over and over that they're going to have a vaccine, and I'm not saying it's going to happen or that it's necessarily true, but that's what the message is, that they will have a vaccine by the end of the year. My guess is Canadians are wondering, well, when will we have one? Is there even a frame, 6 months after that, within 2021, anything like that based on the knowledge you're privy to, that you can share with Canadians?
I won't make a guess on this because, in fact, what I can say to Canadians is that we won't present a Canadian vaccine to Canadians until we are absolutely sure that it's effective and safe. That's the most important piece about vaccination, that the vaccine is safe for use with humans and that it is effective. And that's what the Vaccine Task Force is guiding us with so carefully, is trying to make sure that we're placing our bets with companies that have the most promise to have an efficient and a safe vaccine. That's what matters to Canadians, and that's what I'm keeping my eye on.
Okay, I'll leave it there. Thank you, Minister Hajdu. Appreciate your time as always.
Thank you very much, Vashi.
We want a fair deal for all provinces and territories. We want a fair deal for all Canadians. And that means the federal government needs to step up with an increase in the Canada Health Transfer.
We really need Ottawa to do its part financing healthcare in a recurrent and without conditions attached to it.
The premiers of Ontario and Quebec emerged from a rare one-on-one summit yesterday with a call to the federal government, as you heard there. They want more money for health care, arguing the pandemic has added enormous strain to a system that was already overstretched. So how much do they want and what happens if they don't get it? Peter Bethlenfalvy is the president of the Treasury Board of Ontario. He joins us from Toronto. Hi, Minister. Good to see you again.
Nice to see you again, Vassy.
So we listened to those comments yesterday from both premiers around an increase to the health transfers, and I'm hoping to get some more specific information from you if possible. I know the escalator is 3%. It used to be 6%. The Harper government decided to make it 3%, and the Trudeau government decided to maintain that and continue with that formula. Are you looking for a change in the formula, like an increase to the escalator?
Absolutely. Absolutely. And it's about math. And you're absolutely right in your preamble that the costs have been rising. And this is pre-COVID. They were rising, but they've been rising 5 to 6% a year. We have an aging population. The cost per person in the healthcare system has gone up. The quality, for example, many of our facilities, long-term care facilities, some old ones that we inherited had 4 beds per room. Can't do that anymore. So, and the rare disease drugs. So you add all that up, and the cost pressures on our healthcare system are there, and the revenues, of course. The flip side is the revenues actually aren't growing as fast because our economy is growing a lot slower. Obviously, contracted with COVID, it's bouncing back, but it's just math, and we can't have a unsustainable funding formula. So we're calling on the federal government to increase the escalator. And I'd point out something else. The healthcare spending in this country is about $200 billion, and the feds only put up about $42 billion. So that's a lot of pressure, the balance being on the provincial government. So this isn't just an Ontario challenge or a Quebec challenge. It's in Atlantic Canada. It's in Western Canada, as we have an aging population.
And I have a couple of questions on that, and specifically the federal portion of healthcare spending. But first, if I could kind of circle back to the specific ask. You want to see an increase in the escalator. The premiers yesterday wouldn't give kind of any specific number that they want to see. Why is that? And should you be kind of saying, we'd like to see the escalator increase by X amount, or X percentage, I should say?
I think it's a very fair question, but that's 2 opinions, Quebec and Ontario. We've got 8 other provinces and 3 other territories, and those discussions are ongoing. But I think this is something where we have a shared interest. And, we've worked very well with the federal government. They've provided a lot of supports, one-time supports, but here we're talking about a recurring support so that we can have a healthcare system funding model that is sustainable. And this aging population is continuing. This will be going on for some time. So we need to have a deal where all provinces feel that they're getting a model that works for them right across the country, and that the federal government can participate in that clearly from a financial point of view because they have the capacity. Their percentage of the amount that they've been funding over the years has come down, and as you said, the escalator has come down. So there'll be very specific asks coming out of that.
So the parliamentary budget officer, to the point that you're making, crunched the numbers. His conclusion is a little bit different than the one you presented. He says from 2008-9 to 2018-19, sort of referring there to budget years, federal support through the Canada Health Transfer increased from 27.7% to 32.3% of provincial territorial government health spending in CHT, or Canada Health Transfer targeted categories. And the biggest increases he found were in Alberta and Ontario. Does that undermine the argument you're trying to make?
I don't think so, because if you look at the actual numbers that I just put out, $200 billion in total healthcare spending, and the feds do 42, you can do the math there. So I think that there's an opportunity, a little over 20%. So I think there's an opportunity to talk about the percentage that the federal government supports. There's an opportunity, as you put it, Vashi, to talk about the escalator. And I think this is about the health and well-being of Canadians. That's what we're talking about. So we want to help. That's a common objective. The federal government has the capacity. It's got the printing presses. It's got the willingness. The provinces have the need. We deliver the healthcare services to the people of Ontario. So I think the objectives are and the goal of helping citizens and fixing our healthcare system is a common objective that we can talk about.
So I put all of this to the federal health minister who joined us off the top of the show, Patty Hajdu. I think I articulated what I'm hearing from you, and we heard yesterday from the premiers of Ontario and Quebec. And she was quite adamant that it's a conversation she's willing to have, but only after that safe restart money kind of flows. So after the 6 to 8 months goes by. The point she made was we've given them $19 billion more than provinces were asking for. $11 billion of that is for healthcare. Is that okay? Does she have a point that maybe, take care of the problem at hand, let's get through the next 6 to 8 months and then open up that conversation?
Might not be a good parallel, but I think we can walk and chew at the same time. We have parallel processes here. We have to deal with the immediate COVID situation that we have from PPE, personal protective equipment. These are, one-time, hopefully not a long time, one-time sort of expenditures, testing, which is, a very important part of combating COVID-19, staffing, compensation, a whole range of issues. And we've worked very well with the federal government, but those are one-time funding situations. We have a parallel process. The aging process is going on in parallel. We've got to take care of our citizens, whether they're in long-term care facilities, whether they're backlogged in hospitals because of surgeries, COVID-related backlog. We don't know what's around the corner. So I would submit that we can do both. We can talk about the one-time needs, but we should, in parallel, talk about putting Canada and Ontario on a sustainable healthcare footing.
Finally, Minister, is it fair, I guess, to put the burden of that on the federal government entirely? Is it not incumbent on the provincial government to show that it's willing to increase healthcare spending as a portion of its overall spending? And I ask because, and I know it's a little bit different because we're in the pandemic times right now, and obviously spending has increased, but pre-pandemic, the Financial Accountability Officer, for example, pointed out that the rate of spending that your government had on healthcare would not keep up with the need if it was, projected to be what you had projected to be. So I guess my bottom line is, do you also need to chip in if you expect the federal government to?
Well, we are chipping in, but it is a parallel process. We've got to fund the COVID need because it's here and now, but we also have to deal with the structural deficit in our healthcare system. And this was on the back of our Ontario-Quebec summit, and we talked a lot about that and the kind of health transfer system we talked about before COVID, and we'll continue that. But I should mention that we also had some great discussions with Quebec about some areas as well where the federal government we can work together. For example, in broadband, we've put up a lot of money here in Ontario, and the federal government is very willing and interested in putting up money there, so we can work together. I think that in this COVID world, online is even more important than ever. So working on that together, obviously transit and other forms of infrastructure. So, healthcare, I think we can do these things in parallel, and they've shown a real willingness to do that. And I think we've built relationships with them, obviously with their counterparts across the country. And this is for the benefit of all Canadians. So I think that it's absolutely essential that we continue the dialogue and on all fronts.
Okay, I'll leave it there. Thank you, Minister Bethlen-Falvey. Good to see you again. I appreciate your time this evening.
You bet, Vashi. It's a pleasure.
Peter Bethlen-Falvey is, of course, the president of the Treasury Board of Ontario. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.